Hi, everyone, and welcome to Let Medicare Negotiate, a presentation by Public Citizen, along with our special guest, Counsel for Representative Lloyd Doggett's office, Afton, Cissell. We'll be talking through a few different pieces tonight, and I'm just really excited to have all of you tuning in, whether you're live or you're checking out the recording later. So just to get us started, as you can see, we're in this kind of moment where 9 out of 10 Americans who are being polled really want to see the government take real steps to lower drug prices for Americans by negotiating lower drug prices in Medicare Part D. It's become a huge issue that folks are really on board with, but what we haven't seen until recently is a strong legislative push that draws a lot of people on board. And so we're here to talk to you a little bit about this new legislative push, and then to talk to you all, especially anyone here who's in the field and out there volunteering and really pushing on different issues that you really believe in, but also to all of our other fellow organizers and coalition heads who are looking for cool training tools. We'll dive in the second half of this presentation into really the basics on holding an in-district congressional meeting. But yeah. With all of that being said, I'm Justin Mendoza. I'm the organizer for Public Citizens Access to Medicines campaign. We're a part of Public Citizen that's been working on fighting for lower drug prices and taking on pharmaceutical monopoly power since 2010. However, Public Citizen has been working as a consumer advocacy organization here in Washington, D.C. since 1972, and we work on a variety of issues from healthcare to democracy to safety and lots of other areas around that as well. So check us out at citizen.org or on Twitter at @public_citizen. We'll talk more about the social media stuff later, so I won't bore you at this point. But on the phone and joining us is also Afton Cissell, Counsel for U.S. Representative Lloyd Doggett from Texas. Afton, would you like to say hello?
Yes, hi everyone. Thanks for joining, and thank you to Justin and the rest of the Public Citizen team for organizing this. We're really excited to have all of you participating in both this training and this movement.
Excellent. Thank you so much. Great. So tonight's agenda will be starting out with first an overview of this new legislation, the Medicare Negotiation and Competitive Licensing Act. And a little bit of the background and history behind Medicare negotiation will be in there too. Then we'll talk through the basics on why it's important for real voting constituents to go and meet with your representatives, and then what those meetings look like, what are some of the tools you can use for it, and some of the tips and tricks that I've picked up along the way, as well as many of my colleagues who have trained and worked with grassroots all over the country. So without further ado, I'll turn it over to Afton to walk us through the bill and other pieces there.
Great, thanks Justin, and again, thank you to all of you for participating. So first, just to give you a quick history on the Medicare Part D program, which is where prescription drugs are made accessible. The Part D program first began in 2006, and it was created through legislation that was passed in 2003. And one of the fun facts about the history that a lot of people don't know is that at the last minute, the author of the legislation, who was also the chair of the House Energy and Commerce Committee at the time, added in a single sentence that prohibited the Secretary from negotiating the drug prices under that program. So instead, the program was just going to have to accept whatever manufacturer said as the price. 2 months later, the chairman then resigned from Congress and went and became the president of Pharma, the major pharmaceutical lobby. So no big shock that, once again, we see Pharma's influence over this issue, over our government, and in this program. So the significance of that sentence has been massive. Medicare is paying drastically more than Medicaid and the Veterans Affairs program, and sometimes they're paying more than private insurance plans, and in general, it's just really egregious price gouging is going on in this program. And not all, but a significant part of that boils down to the fact that the Secretary cannot actually negotiate prices. One important thing to note about the way the Medicare Part D program works is that the government contracts with private insurance plans to actually administer the program, meaning that insurers like Aetna and Blue Cross have Medicare plans and that beneficiaries can then pay to be a part of, and the federal government is paying for this program, but it's being administered through these private plans. And the significance of that is that the private plans are able to try and negotiate for drug prices, but unfortunately they're getting really bad deals. And there are two main reasons for that. The first being that these plans are not actually representing the entire Medicare population. They are only representing a very small subset that actually uses their particular plan. And then the second reason being that under the statute that established the Medicare program, we have very robust coverage requirements. So there's 6 protected classes of drugs that have to be covered, and multiple drugs have to be covered within those classes. And in general, the Medicare coverage requirements are much stronger than prescription drug coverage requirements and other programs. All of this boiling down to meaning that there is less flexibility for the insurers when they are trying to negotiate prices. And so ultimately they get really bad deals compared to other insurance programs. So what this bill would do is, first, we would strike that prohibition, and we would actually require the Secretary to negotiate all drug prices for Medicare. And this is huge. Medicare is the largest purchaser of prescription drugs in the entire world, and it has millions of beneficiaries. So the government would be able to represent all of these people, use that purchasing power to bargain and get much better prices for the program. The second thing that the bill would do is, if a negotiation fails, meaning that, say, a drug manufacturer doesn't want to come to a bargaining table or they just don't reach an agreed upon reasonable price, then what the Secretary would do is they would use competition to obtain better prices. And how that would operate is the Secretary would issue a competitive license, meaning that other manufacturers are able to produce the drug for Medicare. So any sort of patents or data exclusivities or any sort of protections that that drug might have had under the manufacturer would be waived, and other drug companies would be able to produce that drug. Therefore, you'd have all of these competing drugs that then the Secretary would be able to negotiate with all of those companies in order to obtain a much better price. And in exchange for issuing one of these competitive licenses, the original drug company that holds the patents and the exclusivities on that drug would receive reasonable compensation for the use of the drug. So this is something that we want to make sure that their investment in the development of the drug is still accounted for, and that they still have the incentive to continue to develop new drugs and that innovation remains in the market. But at the same time, their government-sanctioned monopoly should not mean that they get to charge egregious prices that don't actually compute with either the value of the drug or their need to recoup on their investment and invest in new drugs. So those are the core, but also understanding that if a competitive license was actually issued, that's not the end of the story. It would take a while for other manufacturers to actually get FDA approval, and they would have to prepare for production and actually get the new drugs to market. So during that interim period, we would still only have the one brand name drug actually on the market. So in order to control the price during that time and make sure that we don't see any sort of huge price spikes or just the continuation of the existing price gouging, what we would do is the Secretary would say that Medicare is only going to pay what we call the international reference price. And what that price is, it's a formula that says that countries that have similar economies to the United States, you take the average of the drug's price in those countries, and then that's the price that the United States will pay. Because Americans should not have to pay more for their drugs than people that are in similar economic situations in other countries. We obviously understand why a country that is in a different economic situation, people cannot afford to pay the same prices. And so, of course, we're not going to peg it to that. But if somebody in Germany or Canada or the United Kingdom is paying half the price than what Americans are paying, there's just absolutely no reason for that, and Americans should be paying that same price as those countries. And so we would use that formula to control the situation while we're waiting for competition to come to market. And then once competition does, those drugs would compete during the negotiation with the Secretary in order to obtain much better prices than what we're getting right now. And then the final core requirement to know about this bill is that we also prohibit anti-competitive behavior by the manufacturers. So this is something that currently happens a lot. In particular, one issue that people have heard a lot about is called pay-for-delay deals. And this is when a brand manufacturer actually pays off a generic to stay off of the market. So they enter into an agreement and they say, I'm going to pay you X amount of money and you won't actually produce your drug for 5 more years. And by doing that, they're able to continue to charge their monopoly prices. So situations like that are prohibited under this bill. And I think that covers all of the core requirements. Justin, I don't know if you had questions or details that you think should be filled in on this.
Sorry, it took me a second to unmute there. Actually, no, I think that was an excellent overview. I was waiting to see if anyone brought up any questions from the audience, but it looks like so far none have come up. I would just like to underscore, a couple of the points that Afton said there that makes this just an incredibly exciting piece of legislation for Public Citizen and why we're backing it and why many of the folks on this call who are partners are also endorsing this bill and pushing forward on it. One is this is the first Medicare negotiation bill that's used this very powerful tool of competitive licensing as a piece of leverage. Oh, yes, and the bill number is HR 6505 for folks that are looking it up online. This bill is also one that's been co-sponsored by a large number of members of the House of Representatives. I believe the co-sponsor count is 85 now, Afton, or is it higher?
Correct. It just jumped up by 1 today, so we're at 85 co-sponsors, 86 when you include Congressman Doggett.
Right on, which is a really, really large number. It's the most co-sponsors we've had on a drug pricing bill in basically recent memory, certainly on any bill that lowers drug prices currently in Congress. And then we've actually, today in our office, we were trying to look back over time and find another example, and aside from Medicare Part D itself, we haven't found other examples of drug pricing bills that have had so much co-sponsorship and support in the House. But that's not to say there isn't one, we just haven't found one. So that's pretty exciting. It's definitely got a lot of energy here in DC, and it addresses an issue that just keeps polling. It has been so important to a lot of folks that I've talked to, even when out in the field. So it's really an exciting one for us to see moving forward, and just wanted to say thanks again to Afton for breaking it down here and for being a good partner on this.
Yes, thank you. And I'd like to underscore, how great Public Citizen has been in the development of the bill and the promotion of it. We really appreciate all of the great work and advice that they've given throughout the process, and appreciate all of the support that everyone on this call has offered. And we're really excited about the momentum behind the bill. It has definitely been unprecedented and unexpected, especially for something this bold, that we really haven't seen a proposal like this in recent memory. And so we're really excited to see all of the rallying behind it that we are seeing, and from across the spectrum of the caucus. We've got people that have taken hundreds of thousands of dollars from pharmaceutical companies are now joining this bill. So we're seeing a real watershed moment where people are ready to stand up and take action.
Absolutely. Yeah, and I know on this call now we have a mix of folks who lead large organizations, large partnerships, and large grassroots operations, but also a mix of folks who are grassroots volunteers and organizers right now in the field. Not to put you on the spot, Afton, but do you have any other kind of final words there that you'd like to say to that audience to get them pumped up and excited?
Well, I would just say, it's because of all of your efforts and the energy from, our organizers and advocates and just everyday citizens that's really leading to this moment. It's very hard to motivate Congress to do anything these days, and honestly, it's the number of co-sponsors that we have around this bill is not only unprecedented for drug pricing, but really for any substantive legislation. It's really hard to find momentum behind any particular issue these days. And so we really attribute that to all of the great organizing work that you guys are doing and want to keep building on that momentum, especially going into the new Congress. The reason that we introduced this right now is because we wanted to spend the fall building up that support with everyone and also making sure that the bill was fully vetted, that the public had an opportunity to learn about it and comment and get excited, and we could fine-tune any sort of, language issues or anything that people wanted to contribute to this bill, and then go into January full throttle, very excited to push for passage for this. And so really appreciate all of the work you guys are doing to continue to build that momentum. It's definitely an exciting time.
Awesome. Thank you again. Great. So for the rest of this presentation, I'm going to be breaking down the basics on in-district congressional meetings and how to go and represent the voice of constituents on this bill, trying to push for Medicare negotiation, and in particular, H.R. 6505, Medicare negotiation, and the Medicare Negotiation and Competitive Licensing Act, for all of the reasons that Afton pointed out, and also because, from our perspective, this is one of the strongest challenges to pharma's power. Pharma, as a massive industrial entity, in case anyone on this call is from pharma, I'm talking about your bosses, is a set of corporations that really do wield extreme lobbying power and extreme campaign contribution power. Afton mentioned earlier that some people sponsoring this bill are folks who have taken hundreds of thousands of dollars in campaign contributions from pharmaceutical corporations. And that's just kind of par for the course. It crosses every political ideology. There are different members who still take funds from these corporations. And they use those funds to push back against measures that go after lowering drug prices, keeping drug prices in check, giving the government power to negotiate like this bill does, or especially anything that goes after their monopoly power, which they hold through government-granted patents and government-granted monopolies through the FDA. And this bill goes after both the negotiating piece and those monopolies. So you could guess that this is probably one that pharmaceutical corporations and pharmaceutical trade groups really don't like. So with that being said, part of the reason we wanted to host this training, this kind of meetings with Congress 101 half of this, is to really hopefully get anyone out there who's in the field, already out there doing some advocacy work, pushing things forward on this issue or healthcare broadly, to think about meeting with their representative now in August while folks are home on recess, or starting that conversation with staff in the field, and then planning on meeting before we start the next Congress in January. Because this really is a prime time to do everything Afton described, to have conversations about what parts of this bill could be modified, or what parts represent certain districts or certain communities, and also because we can really build support for it moving into the new Congress. And regardless of how demographics play out in the new Congress, building support for strong action on drug pricing is incredibly worth it to make sure that our loved ones get the medications that they need without having to pay an arm and a leg or choose between purchasing groceries and filling their prescriptions. So just going to start us off with some basics for anyone who hasn't seen themselves as someone who goes and meets with members of Congress. So I do recognize that a lot of folks on this list are veterans on this work, so that's pretty exciting. and thank you all for joining as well. But a couple of the kind of key points that are out there. First, as I think everyone knows and everyone feels and hears in messaging now, our representatives are our closest representors of our voice in the U.S. Congress, right? U.S. representatives are, they represent smaller districts than their senators. They represent a more responsive district, an area where you can collect 100,000 or 50,000 voices even, or even smaller than that in some districts, and make a huge impact on the way that that member of Congress thinks and votes and represents their district here in D.C. So it is an area where we can really work on, truly bringing up the community's voice. And the communities that you're organized in or working in really are, well positioned to really be heard by your U.S. representatives. The other piece is that constituent support really matters right now. Everyone in the House of Representatives is running for re-election. Of course, we work more on the official side in D.C., but for any of you out there in the field, when you're going to your in-district offices, those are still the official side. Those are people that represent the member of Congress in Congress, but they're thinking about, if I support something like Medicare negotiation, is that something that people who vote for me are going to be happy about? And you're there to tell them, essentially, yes, we're going to be really happy if you go out and co-sponsor something like Medicare negotiation and taking on pharma's power. And then finally, the more we band together and build out collective action in our communities, the more we can push for more representative government and one that responds to our needs as constituents and as voters all across the country. So building relationships with your in-district field office, continuing to meet with those in-district representatives and push things forward is a really good way to make sure that, even the cynics among us or amongst our friends know that their voices can be heard by the people that represent them in government. So, of course, a true assessment would give us a full map or a power map to see who has the most influence over members of Congress, who has the least, and everything like that. But rather than dive into a huge theoretical conversation about community organizing, I like to point to a simple chart just to show you really kind of some of the spheres of influence that influence a member of the House of Representatives. So first we have the political party and its leaders. The Democratic Party, of course, has a platform, which, by the way, includes Medicare negotiation. The Republican Party has a platform which includes controlling healthcare costs. You see the parties put out their platforms and talk about the issues. Either platform gives you, as a voter, something to talk about. It also means that they do talk to the leadership of those parties. They hear from the leadership of those parties, but they're not the closest person influencing their day-to-day decisions or their co-sponsorships or votes. Then you have the donor class. We all hear, of course, about the Koch brothers, about pharmaceutical corporations, about, I think there's some kind of red herring things out there about George Soros. Won't give that too much oxygen. But essentially, we've got all these different kinds of donors who, either meet with or have good relationships with members, especially during election years, or are just able to donate large contributions and probably have more capital than you or I do. Personal relationships, these ones aren't really usable by us unless you're married to a member of Congress or family with a member of Congress or a close friend of a member of Congress. But there are those personal relationships, the folks who are closest to them, and in most cases are not also staff, just as a note for anyone who's getting that reference. And then finally, the closest people that matter to our elected officials, especially representatives, are the voters. Honestly, that's why petition power matters. That's why marching in the streets matters. That's why talking directly to your members of Congress matters on the issues that matter to you. So if we're talking about lowering drug prices, who's better to be a voice to your member of Congress to talk to them about this legislation in their home districts than the actual voters and people registered there? Kind of just to reemphasize this point, but also because I think that this draws some good kind of distinctions for anyone who's starting out in grassroots advocacy. So I know that's only a segment of tonight's call, but for anyone who is in that part, borrowed from the Indivisible Guide, there's a couple of things that kind of break down what matters to our elected officials versus things that are a little bit more questionable. They can still be good, but you need to have a lot of the things that are really on your left in the effective column here to be truly heard by your elected representative or other members of Congress. So first we've got real constituents from the district. I mean, imagine in a hypothetical, you're a U.S. representative, and people come to you from a neighboring district and say, hey, this issue really matters. Of course you're going to listen to it a little bit differently than if people come to you who actually vote and live in the place that you represent. It's pretty common sense, but it's worth stating that people from the district who are real constituents actually matter. The other piece, advocacy that actually requires effort. Now, this is kind of listed almost in a cynical way, but what I mean by this is things that you couldn't just do in 10 seconds online, right? Like we send out petitions all the time or requests for people to send a tweet or send an email to a member of Congress, and those matter, but they're less important, far, far less important to towards influencing the actual positions and thoughts of our leaders than if you actually go and meet with them in person or go to one of their town halls and ask a question. Anytime you get that direct contact with staff or with the member themselves, that kind of advocacy really has a much larger effect. Local press and editorials, I'm not going to dive into that much because we're not focusing on that today, but local press, it matters more because it's speaking to that voter base. Just remembering always those voters is what's really in mind here. The next piece here, it breaks down things like the group of constituents versus a single constituent. Even if you're alone, you can make a difference, but try to go and represent an organization that you're with rather than just going as just you. And that's only because, there are lots of different interests throughout a community. And if you're a sole individual who has an interest and that's the only individual talking to your member, it might not be quite as interesting or persuasive as if you're able to say, hey, there are 20,000 of us who are interested in this issue, or even 10. Whatever the group is, come in, present yourself with as many folks as you can. The numbers aren't everything, and we'll talk about that as well. Concrete asks. So a lot of times, especially when I've worked with brand new grassroots activists out there, a lot of folks will be like, well, I'm going to go call my office and I'm going to talk about how, choose a random issue, how nuclear deterrence has resulted in too many nuclear weapons, but they don't have an ask like, and we should reduce the number, or we should negotiate some kind of treaty. Also, this is a weird example, but I was reading an article on it earlier. So, which is fine. Like you could call and just talk to a staffer about a broad issue or an intern about a broad issue, but it's not the same and not nearly as effective as having a very specific ask. So we'll talk about asks in the context of a congressional meeting, but just generally in our advocacy, we want to be concrete and ask something like, would you co-sponsor the Medicare Negotiation and Competitive Licensing Act? Something that's really direct. And then a single ask, as it says at the end. It's oftentimes, if you do want one particular thing or even two particular things, they get lost if you have 15 different asks. So, walking in and asking for public support, for co-sponsorship, for an op-ed, and for a bunch of other things kind of becomes, one, overwhelming, and two, it might not really clearly communicate what's important. Right. So we already kind of mentioned why now. So the only piece I wanted to bring up here that I didn't mention before is that currently the Trump administration has proposed a drug pricing plan or drug pricing blueprint. We at Public Citizen have been one of many organizations who have submitted comments on the blueprint, who have watched the blueprint develop, who've been tracking it over time. And to us, what it really looks like is it's a list. It's essentially the biggest reforms that pharmaceutical corporations will allow to happen so that they can save face with public relations while allowing the Trump administration to claim a win on drug pricing. It's really a big deal in terms of the amount of nothing it will do moving forward and how much it can be used as a political win. So far, though, all signs point to the public not really knowing about the Trump drug pricing report, but because it is out there, it means that it's automatically something that's on the minds of lots of members of Congress, whether they support it or not. And so it is something that is important, and it means that the issue is on the table at the federal level, and also on the table in the poll, and on the table in the party platforms for both parties. So it is something that automatically makes it matter. So meeting with your members right now, that combined with this being an election year and combined with people facing everyday increases in their drug prices and everyday increases in healthcare costs, really kind of turn this into the perfect storm moment to really push for a piece of legislation, a real reform like this bill. Great. So this is going to break down just some of the basics of what you need for a visit in district. And then I meant to mention this before for those of us who are national organizers or organizers with an org who might train volunteers in the future. A version of these slides are going to be available with a training guide that you can take, adapt, strip the branding off of, use in any way that you'd like. All right, so first of all, here's the basic checklist of things you need. You need a posse. We'll talk about that in a second. An actual kind of schedule of how you're going to get it done, as in like the actual date and time of the meeting. You need to do some background research. You need to develop an agenda just so you have something to fall back on. The important one here is to actually go to your meeting with your member of Congress's staff or the member themselves, and then finally following up. All right. So when I say get a posse, I don't necessarily mean something like the Insane Clown Posse. You don't need a crew that's outlandish and wild, though that can be fun. What you need is a group to go in for your actual meeting on the day of your in-district meeting. You can do it on your own. I've done that before when I was doing more grassroots things in the field, and it's okay. Staffers, if there's, as long as it fits into the schedule, and district level staffer is going to meet with you, even if it's one person. And that's fine, but when you're there, you want to do your introduction in a certain way, and I'll mention that later. But what's really key is to bring a group if it's possible. And if it's really possible, get a group of 5. 5 people is the turning point, as shown by a survey literally 2 years ago that asked a lot of members of Congress's staff how many constituents you need to hear from at once on an issue to change from, or to change your recommendation or to make a recommendation to someone else on staff on an issue when you didn't have a position before. I know it's really convoluted, but if you imagine that you're a member of Congress's staff member and your office doesn't have a position on this bill, if 5 constituents come in and say, hey, we represent all these people and we're thinking about this issue, those 5 constituents could flip that member of Congress's vote to a yes, or at least that staff member's recommendation from an I don't know to a yes, which is exactly what we want to do with these meetings. We want to move towards actually getting someone to co-sponsor and be a champion on this issue. So if you have 5 people in the room, you don't want anyone to just be sitting there doing nothing. So with 5 people, I suggest the following roles. Someone who's going to keep time, and I don't necessarily mean checking the watch every couple of seconds, letting everyone know it's been 2 minutes, 4 minutes, whatever. No, but these meetings are about 15 minutes long. That's what you should plan on, 10 to 15 minutes. And during that time, you're going to have to get through a decent amount of stuff, including explaining the basics on the bill and why you care about it as a constituent. So you want to be able to bring it back to the core topic if you get off track. So that's what the timekeeper's job is. Next is a note taker. You're going to need someone not to take every second's worth of notes from the meeting, not some kind of formal Robert's Rules of Order minutes or anything like that, but they should be taking notes of next steps, of key questions, and of key overlaps and similarities that come up during the meeting. Anything that might be helpful moving forward. Because if this is your first meeting, it's an introduction to what will be a long-term relationship with that office and with those staff in your home district. You want someone to introduce, and by introduce, I mean introduce the group. They're the ones that, when you sit down, are the person who starts the conversation. And we'll talk about how to do that in a way that gets things moving in the right direction. You want a storyteller, someone who has a personal story or a story of a loved one or something, or just, a planned story that you've read online from the, unfortunately, thousands, if not millions of patients who have told their stories about high drug prices, something that you can pull from and talk about so it makes the issue a little bit more real. And then finally, an aptly named question master. If anyone has a better suggestion for that, please email me later. But someone who is responsible for making the hard ask of your member of Congress or their staff member. Great. So once you've got your folks and you've thought about who might do what in the meeting, and that's broken down further in our Citizens Lobbying Guide, which I have a link to at the end of these slides. Once you've got that down, you need to find a time and schedule that meeting. So find a time that you can visit, look at your own schedule, talk to the other people, your posse that you're going to bring with you, your group, whatever it is. And then what you want to do is do some research on it. So for folks who have never met with their representative, I hope everyone on this call already knows who their representative is, but just in case, govtrack.us has a great search tool, lets you type in your address and then looks up your district. And then from there, it actually gives you a link back to their website where you can find their in-district phone numbers. Worst case, you could call their DC office, but ask for the district phone number so you don't accidentally schedule a meeting in DC when you're in, I don't know, Maine, right? You want to make sure that you've got the actual meeting where you're supposed to be. And then the other thing to check is you can check the bill itself to see if there are already sponsors. With 86 sponsors overall on HR 6505, you could be in a district that already has a sponsor on it. And that doesn't mean you don't meet with them. That just means that you have a different kind of meeting. But you should check that out on GovTrack as well. And I'll show you in a second where to click for both of those. And then finally, you can look up people's positions on the 3 resources that I have there. VoteSmart.org breaks down everyone's public statements, their press releases on their website, and what kind of stances they've taken on bills in a pretty understandable way. OpenSecrets.org is the best way to see who lobbies your member of Congress and who funds their campaigns. So if there's someone who's taking hundreds of thousands of dollars from pharma, you can know that before you walk in the door and meet with their staff. And then finally, Ballotpedia. Ballotpedia is going to tell you how close that last election was. And if there's any big trends in your district, especially going on with current primaries and things like that, that might be helpful information to know. For instance, someone who's battling a closely held primary but someone who has a better message on healthcare might really want to know what the constituents have to say about drug pricing and healthcare before they go out for their last push before November. So you can use those kind of things as leverage if you look at those kind of three resources, really. And they're all free. That's why I like to point them out. Next on GovTrack, for those that haven't ever found your member of Congress or looked it up or haven't looked recently, check it out on GovTrack at the bottom of the page, govtrack.us. And then to search for that bill text that I was mentioning earlier so you can find out if they're a co-sponsor, just type in HR 6505 in the search button at the top of your screen on GovTrack. Awesome. So when we get to our actual agenda for the actual meeting that you're going to have, I suggest writing it out and printing it just so that your timekeeper can look back on it and go, all right, this is what comes next, and just knowing it. But you want to keep it simple. 5 steps. You could even make it shorter than this, but the 5 steps are just intros, acknowledgements, presentation, making your hard ask, and a plan for follow-up. This shouldn't take longer than 3 minutes per section at the very most. Intros. So the big things that you want to do here is present not only who the people are in the room, like I'm not just going to say, hi, I'm Justin Mendoza, but also how you're involved with the community. If you're a constituent, a voter, you grew up there, great, say that. If you have any relationships or commonalities with that member of staff, look at their LinkedIn, or the representative themselves, make sure you mention that. And if you have any expertise, I know that some NPA folks, National Physicians Alliance folks, should be tuning in on this call. Your doctors, mention that you're a physician in the community. Those kind of things can really help just so that the staff member knows who they're talking to. We all don't like to talk to someone we don't know, right? So if you just explain who you are very quickly, pretty straightforward, but it's important. The other piece is if you're there with an organization or on behalf of an organization, you should talk about a couple of things. One, the shortest of short descriptions. Everyone's mission statement's like half a page long. No one needs to hear that out loud in the introduction. I only say that because I've been in a few of those. And then you also want to mention the size of your organization and especially making it as local as possible. So if you know that you're a grassroots membership organization with 5,000 members in that district, say that in your introduction right after your name. For instance, I would introduce myself as, hi, I'm Justin Mendoza. I work at Public Citizen. We're a consumer advocacy nonprofit in DC with over 400,000 members and supporters across the country. Something that simple is all you need to be able to put forward on the introduction, but it's just so that they know who you are from the get-go. Acknowledgements. So remember that research I mentioned a minute ago, going on GovTrack, going on VoteSmart, things like that? You want to mention some of this. Your whole point here is to show that your crew, your group, or you personally have done a little bit of research, so you're not uninformed, and that you are giving some credit, because each of our members of Congress, well, I'd say most of our members of Congress, have done something in healthcare or something positive that we can point to. That's probably how they're still getting elected, right? So if you're able to find something that aligns overall with your goals of the meeting, for instance, former drug pricing bills, former work on healthcare broadly, other things that you can speak to, find one or two and just give acknowledgement to it, especially if it's recent, saying, hey, I saw this statement that your boss made a week ago about drug pricing. I thought it was really good to see someone speak up on behalf of X, Y, and Z, whatever it is. The considerations here, keeping it short, of course, be ready to redirect. You might say something that that staff person wrote. That press release could have been their project. And then it's like, hey, yeah, thank you so much for mentioning that. I actually wrote that. You can talk about it for a couple of seconds. That's great. If you end up wanting to know more or like personally wanting to dive into it more, save it for another time and try to redirect back to your agenda. Mostly because everyone's time is stretched in this, and you want to make sure you get through your agenda. That's why you set up the meeting. Next, don't stretch it. You could read that someone, maybe co-sponsored, or no, maybe someone voted on a recent sense of Congress on drug pricing, which actually happened in 2017, which really is just a statement saying Congress cares about drug prices. Don't be like, oh, your amazing leadership on drug pricing has inspired me my entire life. That would be a stretch if all they've done is vote on that sense of Congress. Honestly, though, we're all human, so if you're not perfect, you see something and you acknowledge something a little bit too excitedly, that's fine. I just mean don't pretend like someone's already a huge champion, because then when you ask them to do more later, it might feel a little awkward. And then finally, don't be a fan. It's actually really hard sometimes. A lot of our elected officials have national prominence, or they give really good speeches, or we were excitedly voting for them last fall. Sorry, not last fall. Excitedly voted for them in 2016 or 2014 or whenever we last voted for that person. Don't be too excited just to be in the building and be there, mostly because it just gets a little bit distracting for you. It makes it a little bit harder to get back on target. You want to present the problem. So here the big thing is to make the problem real and the solution simple. By that I mean, drug pricing is a big problem, but mostly we talk about it as like, oh, it costs the entire healthcare system a lot of money, yada, yada, yada. If you have a personal story or something, for instance, I like to point to, I like to point directly to, my nephew has type 1 diabetes, and I know that his family's copay on it a couple months ago was over $500 for insulin and other diabetes supplies. Pointing to those kind of things that tie it back, so it's not like, oh, there's this weird kind of existential problem with drug pricing, but there's a real problem and it's right here. That can really help. And then making the solution simple. My nephew was a bad example since he's too young for this, but say that you were talking about your grandmother who also had an insulin expense that was really high. You could say, but if Medicare would just negotiate lower drug prices for her, I'm sure she could afford it in the future. Something that simple can move it forward. The hard ask. This part is the part that sometimes makes people the most uncomfortable. When you're meeting as a constituent and as someone out there, you can almost always feel positive about your meeting with a member of Congress's staff. These people are all genuinely nice and genuinely charismatic. Mostly, I don't think I've met a staffer that hasn't been nice and charismatic and interested and out there and happy to meet with constituents. So you're going to meet someone who's going to be, nodding along, taking notes, asking a couple questions, talking with you, telling you a little bit about their boss's views and about their office's work. But you can get lost in that, and you can forget to actually ask the question you came there to ask. So make sure that your question master, or whatever you end up calling that person, finalizes it with a yes or no, something that you can really take with you. Yes, no, maybe, to be more honest, that you can really take back with you and have a real follow-up conversation around. So just a couple of suggestions are here for a real legislator directly. If you're meeting with your representative in August, say you went to a coffee hour and you get a chance to talk for a couple of minutes, asking something like, would you consider co-sponsoring the Medicare Negotiation and Competitive Licensing Act is a totally fine question to ask. You might not get a yes, for sure, absolutely. You'll probably get a, that's something we should consider. Can I follow up with you? That's great. That's what you're looking for, that little let's follow up piece. And if you happen to meet a staffer, which is actually more likely for many of us, unless we're in one of the major cities or hubs that people are going to be in August, and you start moving quickly, if you're meeting with a staff member, asking, do you have what you need to recommend this to your boss or to your team, is really a good way to set up a good hard ask at the end of your question. Finally, I've just got a couple of tips, tricks, and FAQs, and I'm going to open this up for Q&A and turn off the recording. So first, bring some materials. We just put up a leave behind one-pager document that you can bring on this bill, the Medicare Negotiation and Compulsory Licensing Act, or Competitive Licensing Act, apologies. You can find that at citizen.org/access under our Take Action tab. Bring your business card, that's the other material to bring, just to let people get your email and your swap. And then finally, if you do represent a local organization, bring your one-pager or your website URL so that that staff member can look at you guys, look at what your expertise is, and see if you can be a future partner or resource moving forward in the district. Finally, these are just kind of some final reminders. First of all, folks often feel like, especially on their first congressional visit, I remember my first one, it was actually in college, I remember feeling like, oh man, what do I know about this issue? And the reality is representatives work for the constituents, right? We're the ones that vote them in. I mean, I'm a DC registrant, so it's a little different. But we're the ones that vote them in. We're the ones who go door knocking when their campaigns ask for volunteers. We're the ones that do that kind of those kind of things, and representatives in their offices know that. That's why they're listening and having meetings with constituents. While you're there, you want to listen. Shoot to listen about 50% of the time. You don't want to just dominate and lecture like I just did for this whole webinar. You want to actually sit back and ask some questions. Understand what the views are of the office. If they're saying, yeah, I've read this bill, here's what we've thought, listen to that. Have a little bit of a conversation. Hear it out. Take some good notes. That's why you need a dedicated note taker, someone who's going to write down those action items and takeaways for the future. Finally, what if you get nervous? Well, if you get nervous, maybe you're a nervous public speaker, maybe you're nervous one-on-one in interactions, maybe you're nervous about having so many details in front of you when you're meeting with a member of Congress's staff. That's fine. Just take a deep breath, go into it relaxed, and just know that we're not looking for perfection in these meetings. We're looking for true, honest, real constituents who happen to know a little bit about an issue and want to push it forward. And then if you don't know something, sometimes the staff member will have knowledge on the issue that maybe you don't even have. Maybe they're a lawyer that's worked on intellectual property and knows competitive licensing really, really well, or has some views that they've heard from an economist, or maybe they talked to a pharma lobbyist literally 2 days before that and have their talking points fresh on their minds. If they ask you a question that you don't have an immediate response to, that's fine. Don't make anything up. Just say that you'll look into it and get back to them, or try to get back to them with some resources. And as a hint, you can always email me if you have one of those questions, and I can try to connect you to someone in the Access to Medicines community who might be able to get you a response. Great. So the final thing there is after the meeting, follow up. Especially if you get those questions I just mentioned, write them down, take them home, reach out to someone and try to get those answers. But regardless, as soon as you leave the meeting, just like leaving a job interview, you should send a message within 24 hours, thanking them for that meeting, send them a copy of any leave behind documents that you brought with you, and send them the contact information of folks that were in the room, so that if they have further questions or would like to invite you all to an in-district event or something like that, they have your information. It's a great way to start fostering that relationship with your in-district office and moving things forward. All right. So, I'm going to turn off the recording so we can just have a candid chat. Thank you all for tuning in. And yeah, hopefully a lot of you go out there and start going after these in-district meetings.